who's eligible for the booster. Hopefully the data has made it super clear to you that boosters are effective and extremely important for preventing infections, but more importantly, hospitalizations and deaths. But let's move to who's eligible, and hopefully we can clear up some confusion around who's eligible. So really all Delawareans 12 and older are eligible for a booster if it has been a certain period of time since their primary series. So if you're 12 and older and you receive Pfizer as your primary series, and it's been 5 months since you got your second dose, you should get your booster as soon as possible. If you receive Moderna as your primary series and you are 5 months past your second dose of Moderna, you should get a booster as soon as possible. And if you receive J&J as your primary vaccine, and it's been 2 months since you received your J&J, you are eligible for your booster and you should get it as soon as possible. Now, for those who are 18 and older, you can choose any one of the vaccines. If you're under 18, 12 to 17 are those who are authorized for boosters now. Pfizer is your only option for a booster at this point. Here's one of the points where we've seen a lot of confusion. If you have had COVID, the infection, which we know many people were infected in the last 4 to 6 weeks, as long as you are no longer in quarantine or isolation, you can and should get any vaccine that you're eligible for, whether it's your first, your second, or your booster dose. So if you got COVID and it's been 10 days since you got COVID and you don't have symptoms or a fever, you should get your whether it's your booster, your first dose, your second dose as soon as possible. Don't wait any longer than you need to get up to date with your vaccine.